My name's Mike Thompson, and I'm the Triad Coordinator here at RSVP. Welcome, and thanks for joining us. Just want to take a couple of seconds. If you would, please mute yourself while we're doing the program, and then I'll let the speaker decide how she wants to do questions, okay? Let me turn it over to Bruce Beckman from Coventry Village, who arranged for the program this morning. Bruce, take over, please.
Yes, thank you, Mike, and thank you for inviting us to be a part of the presentation today on this really important topic. I'm Bruce Beckman. I'm the sales director here at Coventry Village, and part of our team is Ageility Rehabilitation. It's part of our same parent company, 5-Star Senior Living, and Ageility Rehabilitation provides outpatient rehab services here for not only the members of our retirement community, but also the greater Madison area. So I'm very pleased today to present our Director of Rehabilitation, who is Kristine Niestrom. So she's here to provide us a lot of information about safe mobility. And with her also is Julie Weiss, the Regional Director for Ageility Rehabilitation. And I'll let Kristine and Julie tell a little bit about themselves if they'd like to. And just thank you again for allowing us to be a part of this presentation. Thanks, Mike.
You're welcome. Thank you, Bruce.
Okay, hi, I'm Kristine. I am the Rehab Director at Coventry Village. And thank you guys all for coming to my presentation today. Something with the safe mobility. So a little bit about myself. I've been with Ageility for about 2 years, working mostly with older adults within our community. I see people in independent living, assisted living, and memory care. I've been a physical therapist for about 7 years. I have my doctorate from Midwestern University. I've treated anywhere from, I think my youngest patient was 5 and my oldest patient's been, I think she was 103 or 104. I can't remember, but I have a very wide spectrum of patient population that I've treated. But like I said, currently for the past couple of years, I've been focused mainly on older adults, which I've really enjoyed. I feel like you guys are one of the hardest working, patient population. So I really have enjoyed my time doing this. And a little bit of personal information. I have a 4-year-old son and I'm currently 39 weeks pregnant. So I was happy I was able to make it to the call today. So yeah, I'm excited to get to talk to you guys a little bit today. And in terms of questions, if anybody has any questions, definitely feel free to ask throughout the presentation, or you are also more than welcome to wait to the end. I will set some time aside at the very end to talk as well. So, right, we can get started. All right, so some objectives for our presentation today. So we're going to talk about mobility, what it is, kind of aging and how our body change and how that affects mobility, how to maintain our mobility, planning for our decline in mobility as well. And then also we'll get into some assistive devices, why to use one, when to use one, and kind of what kind to use based off of you and your therapist or doctor's recommendations. So we'll start with mobility. So what is mobility? So mobility is the ability to get where you want to go, when you want to go there. So why do we want to talk about mobility?
Background. They won't.
So why do we want to talk about mobility? Obviously, our mobility is where allows us to get to where we want to go. We want to go see our families. We want to go to activities. We want to go to the grocery store. Mobility is a very important part of our lives. We have to be able to be mobile to do the things that we want to do, the things that we need to do. So we also want to plan for mobility as we get older. So people plan for retirement, they plan for college. So why not plan for the mobility changes that may come with aging? So some facts about aging, mobility, and the quality of life. People are living a lot longer. 1 in 4 Americans will live until their 90s. Planning for mobility is important for older adults to stay independent in their own homes and communities. Falls and motor vehicle crashes, which are related to mobility, are the leading cause of injury and death in older adults ages 65 and older. When older adults stop driving or fall, they often experience a decline in their health, social interactions, and ability to grow around. So as you can see, all these things are important reasons why we want to kind of focus on mobility and why it's important to stay mobile. So how to maintain mobility and independence. Big thing that we need to do every year is our physical checkup. So there's a lot of health issues out there that can relate to your increasing your risk of falls. So some examples of those would be, diabetes. That's one thing we know can cause decreased sensation in the feet, that can cause balance problems. There's, different diseases out there like Parkinson's that can cause poor gait mechanics or ability to walk, obviously causing more balance issues. Hip and knee replacements, they're done like every day, all day. Lots of people get them. That can cause a lot of lower extremity weakness. Weakness is a big factor with falls. So again, another big reason to get that checkup every year, to kind of talk to your doctor about any issues you might be having so that they can make sure that, you're getting diagnosed and treated appropriately. So that can also help with reducing your balance issues. Reviewing your medications with your doctor or your pharmacist. This is another big one. Obviously medicines, we all read on the side, they have tons of side effects. Definitely interactions between other drugs. As we age, we always tend to see that we have more medicines added every year. And so the more medicines that you're taking, the greater the risk of one of those kind of severe interactions, which can a lot of times cause balance issues, weakness, dizziness, those kinds of things that can lead to falls and limit your safety with mobility. And a big thing is especially when you're put on a new medication, is to being very careful with kind of how you're moving those first few days, because it takes a while for you to kind of get acclimated to those drugs sometimes. So, those first few days is always kind of a big thing to watch for when you've taken a new medication, and to keep in contact with your doctor if you're having any issues there. Getting a regular eye exam every year as well. Vision problems can increase risk of falling and being in a car crash. Vision is one of the main senses we rely on for balance. If you've ever tried standing still, closing your eyes, you can tell that the difference in your ability to maintain balance and stability is a lot different than if your eyes are open. So again, big, very important for you to get your eyes checked every year. Make sure that your vision is doing okay, or you have the appropriate, glasses or contacts or whatever it is that you wear to make sure that, you're seeing as best as you can. Another thing is, obviously, there's obstacles that we can run into, cords and things like that. You want to be able to see those things, those environmental things as well. Also, following a regular activity program that focuses on strength and balance is big. Strength and balance training for at least 3 times a week can reduce your risk of falling. Walking is good, but does not prevent falls. I get a lot of patients that tell me they exercise and they go for walks every day. They should be fine, which is great. It's really good for the heart to do the walking, but for balance and decreasing your fall risk, it really has to be more strength training and balance training. So you need a strong base of support, like a strong foundation, and you have to practice your balance in order to have good balance. Balance as we age declines in general. We become more rigid as we age. meaning that we're unable to move how we're supposed to. Our reflexes and our central nervous system slows down, which can decrease our ability to react to any kind of perturbations. If we're thrown off balance a little bit, our ability to kind of step quick enough to catch ourselves, those kinds of things, those all kind of slow down. So those are important factors to kind of remember. And with exercise and practicing those things, you can kind of maybe not necessarily prevent it, but at least slow down that process that happens to us as we age.
Let me just butt in a second, Kristine.
Sure.
Everyone, I don't know if you attended last year, but Kristine did a program for us about exercises and falls prevention last year. Now, if you go to Triads of Dane County YouTube, you'll find that, and there'll be an hour of terrific information about exercising and all of these things to help you improve your balance. So please check that out. Okay, Kristine, back to you.
No, that's good. That's okay. I did that video also has exercises. We did like a whole section on doing the exercises too. So a lot of those exercises that I show on that video are great exercises to do. So thanks, Mike, for mentioning that for balance. So all right, where am I? Here we are. So the next step is planning for a decline in mobility. So trying to make sure that you kind of plan for your future is, like I said, very important. So I found that this My Mobility Plan, it's on the CDC website, is really a nice tool to use. And I'll pull it up in a second. And I put the link here, and I can also put it in the messaging tool at the end too, if anybody wants it. But it kind of goes over a couple different sections, just ways to kind of start preparing yourself and kind of how you want to move forward. If your mobility does start to decline, it can keep you independent a little bit longer, as well as keep you in your home longer, those kinds of things. So it looks at, yourself, how to stay independent, managing your health to maintain mobility. It has a home assessment in it. So how to stay safe in your home, gives you a checklist to help prevent any falls. And then My Neighborhood, which is one of the steps I think that we forget a lot about, is how to stay mobile in your community. So a plan to how to get around your community is a really great thing to kind of look at too. So I'm going to pull that up for you guys here. So here's the My Mobility Plan. And again, like I said, it's on the CDC website. And here's the myself. So this is kind of what we went through first, how to plan to stay independent. So staying healthy and managing your conditions can help with maintaining your mobility. So that kind of gives you a checklist. So again, this is the getting your physical checkup every year, making sure, you're checking in on any of your, issues, or if they're having any more issues, those kinds of things that they're getting taken care of quickly. Reviewing all of your medicines with your doctor or your pharmacist. Again, with those drug interactions, those can be detrimental to our, balance and our health sometimes. Getting your medical exam or medical eye exam every year, making sure your vision is good. As well as following the regular activity program. Like I said, the doing the strength and the balance at least 3 times a week. It's kind of nice because they have a little chart kind of started for you, so you can kind of plan yourself out. I'm a planner. If I don't write it down, it doesn't happen. So, trying to, I think it's a nice tool because then you can write it down and kind of hold yourself accountable a little bit.
Kristine, this is Bruce.
Yes.
Your PowerPoint is still on. It's not showing the
no.
website.
No. Okay. Darn. Let's see. Let me try. Here we go. This might work. Okay. Is it showing it now?
It is. Thanks.
Okay. Thank you. Thanks, Bruce. Sorry, guys. All right. So like I said, this is the myself thing, which we kind of went over. I talked about earlier, like I said, the physical checkup, eye exam, medicines, the regular activities. So like I said, there's this chart here, which is kind of nice, holding yourself accountable, writing it down on a calendar, you know, I think those are great things to do to kind of make sure that you're, you know, staying on your plan to keep yourself healthy and strong and independent. Let's see. And then this is the my home part. So this is a plan to stay safe at home. So this is nice. You can kind of go through your home, and it's a little checklist on just making sure that you stay safe within your home. There's no objects, you know, that can cause tripping hazards, those kinds of things. So checking the floors in each room and reducing tripping hazards. So clutter, big thing. I see a lot of newspapers on the floor, a lot of times in magazines. So that's one thing I know I always look at when I go into patients' apartments. You know, rugs are another big tripping hazard that I always see. If you have to have the rug, try and have it taped down, or really make sure that it's, you know, on the floor very good. As well as any kind of wires. Oxygen tubing is another one I see that gets in the way a lot. So really kind of paying attention to where you're walking, you know, what's kind of your normal patterns every day, those kinds of things, and making sure you have a clear path to the restroom, the kitchen, those places that you go to frequently is really important. You know, check the kitchen, putting your used items that you use all the time within easy use, usually about waist level. That's a big one. You don't want to be stepping up on a step stool to grab something every day. You know, use that for that once a year Christmas plate that you take down to do that. And then, like it says too, if you're going to have to use a step up to get anything, use a step stool, not a chair. The chair just never seems to work well. It's usually too high and usually moves around a little bit. You want to check your bedrooms. Lighting is a big thing, especially
good, no problem.
You know, get up.
Mike, or was it your mic's tip there?
Checking the bedrooms, make sure you use bright light bulbs. You know, place the lamps close to the bed where they are within reach. So being able to kind of turn those on easily, and placing night lights, especially on your way to the bathroom. If you go to the bathroom a lot, having that night light's helpful. Kind of like we talked about earlier, your vision is a huge part of your balance, and we rely on it a lot for our balance. So when we take our vision away, when it gets dark at nighttime, our vision does, or our balance does kind of decrease. So having those night lights can really help with that. Checking inside and outside stairs and steps. So making sure you're looking at if there's any uneven steps that need to be repaired, making sure if you have carpet on your stairs that those are nice and firmly attached, or that you have non-slip rubber treads. Those are really good. Checking for loose or broken handrails. Also consider adding handrails if you don't have handrails, especially I know a lot of, you know, garages or front doors, those kinds of things don't have a handrail on them necessarily. So even if it's like 1 or 2 steps, as you get older, those 1 or 2 steps can become very difficult. So thinking about adding those handrails onto those points are really useful. Using bright overhead lighting on the stairs is good. And then consider putting light switches at both the top and the bottom of the stairs too. And then the bathrooms, making sure you're putting those non-slip rubber mats or self-stick strips on the floor of the tub or shower. That's going to be a little bit more stable if you're standing, or if a shower chair is also really good too. Then you can sit and shower and don't even have to worry about the standing part. And then also consider, you know, installing any grab bars for getting in and out of the tub or shower or up from the toilet. It can be helpful as well. And then I really like this little mobility tip. So falls are more likely when wearing inappropriate footwear, such as flip-flops that do not cover the heel, or slippers. That's another thing. Slippers, they're slip they slip. So making sure they have good tread on them and that they are covering your heel as well. So you want to really make sure you're wearing safe shoes that fit well, have a firm heel to provide stability, and have a textured sole to prevent slipping. Like I said, even in the house, your slippers, trying to make sure they have a nice rubber tread on them is important as well. And then next I have the My Neighborhood. So this is kind of nice because, again, it looks at your ability to stay mobile in the community. So kind of filling out this little chart below is really nice. So kind of looking at where do I go now? So making a list of kind of those places that you go frequently, grocery store, friend's house, family's house, activity, those kinds of things. How do you get there now? Do you drive? Do you take public transportation? And then thinking about how will I get there in the future? So, if you're no longer able to drive, what's your next, step? Are you able to get to a bus stop easily? That's another question. Are you going to be able to walk to the bus stop? Do you know how to use one of those ride shares like the Ubers and Lyfts and those kinds of things, or calling a taxi? There's lots of different options for you, but it's nice to kind of know, those options that you have, because, one day you're doing well, the next day, sometimes you fall, you break your hip and you're not able to drive. So how are you going to get there? So kind of having those plans set up for you is going to take some stress off of you if anything does ever occur like that. They also have this nice kind of website here that can kind of help find some of those transportation options for you based off of your zip code. So that's kind of a nice little thing you can use too. And they also have some information on a driver refresher course, which is kind of nice just to make sure that your driving's still safe. And then just, the mobility tip, just making sure that you're always wearing your seatbelt. I think that's always a good one. All right.
Would you be able to, Kristine, copy and paste that URL into the chat box?
Yep, I can definitely, maybe I'll just do it right now before I forget.
Yep, that's a really great tool.
Yes, yeah, I think so. Let's see here. All right, so I put it in there for you guys.
Great. Thank you.
You're welcome. All right. We'll go back to the PowerPoint here. All right, is my PowerPoint showing?
Yes.
Okay, great. All right, so kind of for the next section, we have assistive devices. So kind of now that we've talked a little bit about mobility, we're kind of moving into why possibly an assistive device would be right for you, or when to start thinking about maybe that might be right for you, or to have that conversation with the doctor. So why use an assistive device? So they can allow you to safely interact with people and your environment. They can help to improve your quality of life. They can help you to maintain your independence, increase your activity, and can improve your balance and offset pain. And we know that disability and those assistive devices can help, but just know that assistive devices are not without significant, musculoskeletal and metabolic demands, meaning that they do require increased effort and energy sometimes to use those assistive devices. So looking at when you possibly may need one, if you're having issues with your balance, you're noticing that you're tripping more, you're hanging onto furniture more, you're a little bit more hesitant to go for walks, those kinds of things are red flags that the balance is starting to go down a little bit. Increased fatigue is another one. You're getting more tired on your walks. You're getting tired just walking to the bathroom, those kinds of things. Increased weakness. Again, you're feeling like you need to sit and rest because your legs feel like they want to give out. History of falling. That's a big one. There's a big increased risk of falling after you've already fallen. So that's kind of always a good indicator that assistive device may be appropriate for you. If you have pain with mobility, whether it's just, pain with walking, pain with getting up and down, those kinds of things, medical need due to a specific diagnosis. We kind of talked about those before. There's a lot of diagnoses out there that, stroke, Parkinson's, those kinds of things that you would most likely be prescribed a assistive device for. And then also if it's prescribed by a doctor or therapist, really taking that into heart. We're most of the time we're not telling you to get one because for no reason. There are usually lots of reasons why we indicate that there's possibly a need for you to have the assistive device, and you have questions on that. Make sure you definitely ask why, why it would be necessary for you to have that assistive device. So then looking into the what kind to get. So the big caveat to this is get evaluated for one. Most people are never properly instructed on the proper use of devices, and many of the assistive devices people use are inappropriate for them, damaged, or incorrect height. So I always say make sure you're getting evaluated for one. Don't go out and just get what you think you need. Selection of an assistive device depends on your strength, your endurance, balance, cognitive function, environmental demands, meaning like, where you live, if you live in a house that has stairs, if you're active, if you're not as active, also your medical history, so different diagnoses that you may have. There's a lot that can go into choosing the right assistive device for you.
Who would you talk to about this? Who would help you discuss? Just talk to your neighbor and say, hey, does this cane look cool? Or
Yes.
what do you do?
No, so I would say definitely talking to your doc is the first step. Whether or not they know exactly what to do. A lot of times they will have, what they think that you should use. And a lot of times they will give you a script to go see a physical or occupational therapist that can definitely dive a little deeper into what you might need. So that's definitely part of my job. I know I do a lot of assistive device evaluations. I get patients in and I, fit them with what is going to work appropriately. And we go through all of these things. I look at their strength. I look at their walking. I look at their endurance. I look at their balance. I look at how they're doing cognitively. We talk about their house and their environment, what things they like to do, where they like to go, and we talk about their medical history. So that all kind of goes into, ensuring that we're getting you the best possible assistive device. So talking to your doctor and talking to a physical or occupational therapist is kind of the best route to go, not your neighbor. And then also we make sure that, you have the proper fit and that you're using it appropriately as well. The number of times I've seen people come in using a cane on the wrong side or using a walker that doesn't fit them is probably 75% of the time. So that's part of why I say one of the most important things, if you are thinking about you may need an assistive device, is to talk to your doctor, talk to a therapist first before you go out and buy anything, because they are easily accessible to get, at Walgreens or, those pharmacy stores and things. But getting a little bit of help first, I think is the best way to go. So some of the assistive devices that can be prescribed, canes, walkers, wheelchairs, scooters, power wheelchairs. I kind of chose today to just stick with the canes and the walkers. When you get into the wheelchairs and the scooters and the power wheelchairs, that's just a whole nother ball game. And that definitely you have to talk to somebody about. There's a lot of different components to those three things that are, I think, a little outside the bounds of, just the canes and the walkers, which kind of are our more frequent things that we use at this point. So we'll talk a little bit about canes here. So canes can help redistribute your weight from your lower extremity that is weak or painful. It increases your stability by increasing your base of support. And if you're not sure what base of support is, it's kind of like you think about putting your feet together and then putting your feet apart. What's going to be more stable? Having that wider base of support, so those feet further apart, is going to give you a more stable base. So adding that extra support system is going to widen your base of support, so that increases your stability. It can provide tactile information about the ground to improve balance. If you do have a cane, you want to make sure it's at the wrist crease, so that kind of where your wrist bends, that's where you want the cane to kind of sit if your just arms are naturally down at your side. And you want to use on the opposite side of your weakness or your pain. So there's different types of canes. There's the standard, which is just kind of like a straight cane. They're inexpensive and lightweight. They can help with balance. And they're best for somebody who doesn't need the upper extremity to bear weight. There's the offset canes. Those are the ones with the handle that's kind of placed over the shaft of the cane. And those are for patients who need a little more of that upper extremity to bear weight. They need to bear weight through the cane a little bit more. So those kind of example of those would be like somebody who has gait problems or difficulty walking because of pain from like knee or hip arthritis. And then there's the quad cane. So these are the ones that have the big 4 prongs on them. And they have the largest base of support, and they're the most stable, but they are also the most heavy and difficult to use. And they can stand on their own. Usually those are ones that I would only recommend for somebody who has had a stroke and they have the hemiplegia. So the one side that's kind of weaker than the other. And then the big challenges with those are all 4 points of the cane must be in contact with the ground at the same time in order for them to be used properly, which can be very challenging when you're walking with them. And then we're going to look at walkers. So walkers are good. They improve your stability, especially for those with lower extremity weakness or poor balance. Again, they increase your base of support. They can help support weight. Again, you want the height at the wrist crease. And there's a few different types. There's the standard, the front wheeled, the 4-wheeled rollator, and the 4-wheeled upright. And I'm going to show you those on a different slide. But just kind of a con to those. So they can result in poor back posture, reduced arm swing, and require greater demands than canes. And also you have to think about stairs. It's very hard to do stairs with walkers. The standard walker is the most stable walker. That's the one that has no wheels on it. So it's obviously going to slow down your ability to walk. You have to completely lift the walker off the ground with each step. And it's difficult for people with decreased upper body strength. So that's kind of the standard one. Don't use that one too often. We usually kind of look more at the 2-wheeled walkers and the 4-wheeled walkers. So the 2-wheeled ones are the ones that have the 2 wheels in the front, or they're also called the front-wheeled walker. They're more stable. They help to normalize the gait pattern, and they're good for balance deficits. And then you have the 4-wheeled walker, which is also called a rollator. So this one is for more high functioning people who do not need to bear weight. They're easier to propel. They're not appropriate for balance problems or cognitive impairments. and they usually have a seat or brakes on them. The big con with those is they can roll forward unexpectedly and result in falls. And that's why I mentioned the cognitive impairments on there. You really have to have those brakes on all the time, making sure that you put it against a wall if you're going to sit down, or other solid object before you sit down, and put those brakes on to make sure that you're using in the safest way. And then we have so those 4-wheel walkers, you can split them up kind of into two groups. And this is kind of the big question I've been getting a lot, is the rollator, the ones where your hands are just on the handles, and then you have the upright, which are a newer walker that we've been seeing in the past few years, where your elbows are actually supported in those. And I can show you, I pulled up some pictures. I can show you guys pictures too, if anybody isn't sure which one's which. But they're all both nice because they have easy grip handles. They both have a seat and a mobility pouch. With the rollator, you have to use your core for upright posture a little bit more. And the upright one is more, promotes that upright posture because you have the elbows on the armrest, and that kind of helps to push you up a little bit better. Though the rollator is smaller, so it's a little nicer if you're going to use it to get in and out of like car or those kinds of things. The upright is a little bigger, so that's something you have to kind of take into account as well. So like I said, those upright walkers have become more popular due to the thought that it, helps with improving upright posture. And it can, if it's used correctly, though I do see a lot of people whose shoulders are, pretty much touching their ears if they're leaning on it. So with both the rollator and the upright rollator, it's really important just to make sure that you're engaging your core all the time, pushing those shoulders away from your ears to make sure that, you're keeping yourself upright and not hanging on the assistive device. So something again to take into account. Again, another reason why I like people to come and see me before they get a assistive device is to make sure that they are using it appropriately, that we can go over the posture, because if you're walking with poor posture all the time, then you got other things that are going to start happening, neck and back pain, those kinds of things. So those are kind of those rollators there. So in summary of our presentation today, so making sure you perform regular strength and balanced exercise program, regular physicals and eye exams to maintain mobility, plan for your decline, for a possible decline with My Mobility, and then talk to your doctor or therapist about need for an assistive device, weigh the pros and cons of them to decide on what is the most appropriate for you, and make sure your assistive device is properly fitted and you are trained on how to safely use. Okay, so does anybody have any questions at all?
Feel free to unmute yourselves and go at it. Kristine's got a lot of information here for us.
I can look in the chat here too.
Oh, hi, my name is Liz Collins. I'm a nurse, and I'm very interested in fall prevention. And so I appreciate how you summarize all of this in such a great package. And I just recently have come back from visiting my parents who are in their early 80s, living in Florida. And what I find is sometimes they're not always, open to, even though I'm a nurse and have a lot of information or provide them information, my parents aren't always open to, to change. And I didn't know if you had some suggestions about that, or, what I see is if there was, when there's some event that happens, an injury or something like that, they're great at following doctor's orders. They're into following, the medical regime. But if it's something that is not totally necessary, more on the prevention end of things, they're not as open. But I guess I have two questions. If you have any suggestions about change for older adults that are maybe not open to that you when you see hazards, and then also if there's some type of role, because I could give this to my parents, this form, which is great from the CDC, but I'm not confident that they would work through it. Where if there was an individual that, besides myself, going through it with them, they would probably be a lot more receptive. So I know I said a lot of stuff right now. I would love to hear your thoughts, and thank you so much for this great presentation.
Sure. So change, obviously, that's definitely something that's hard for a lot of us, and for myself as well. I think that that's a tough one. When I work with patients and they are resistant to the changes, I think that there's a lot of education involved. That's kind of where I start. And also I do a lot of testing with them. So for me in my profession, that's kind of what I do. I kind of show them, where their deficits are, and then educate them on, what those deficits could lead to. I try to really get to know my patients and what motivates them. So if they really, enjoy going to, bridge club every week, I talk about, okay, so if you fall or if something were to happen, because you're not using your walker, you're not going to be able to do these things anymore. So kind of, I guess, setting them up for that possibility can sometimes motivate people. Like I said, a lot of education on why it's important. We all know, we've all seen our grandparents get older. We've seen our parents get older, those kinds of things that aging comes with difficulties. I mean, we always say aging is not for sissies. It's hard work. It's hard to get older. We, lose some of our abilities and our independence, and that's the last thing anybody ever wants to lose. So kind of really pushing that keeping that independence for as long as you can really helps me to get my patients motivated. If I can really find, what drives them. And a lot of times, like I said, it's their ability to maintain their independence. So I don't know if that kind of answers that first question. That's how I approach it. And then I'm trying to remember what your second question was. What was it?
It was about, the role of.
Having somebody go through it.
Correct. Like would be best for that. I mean, do you always have to? Yeah.
I would definitely, if they're more of, looking to talk to a doctor or a therapist, that's definitely something that they should be able to kind of go through with them if you brought it with, or even like calling ahead to see if that's something they would go with. Doctors usually have, a little less time in the clinic, they're kind of a bump. If they even, I would recommend them prescribing physical therapy, and then having the physical therapist who usually has like a full hour to like sit and talk and evaluate, go through something like that with them. That would be if a family member came to me and that was kind of the goal, then I would be on board. So either one could really do it. I just think that a lot of times the therapist probably has a little bit more time. I would think the doctor could definitely give the form to give to them, but I don't know if they would necessarily go through it with them or have the time to go through it with them. I'm not sure. Depends on the doctor too.
Sure. Thank you so much. This is really helpful.
Good. You're welcome. Any other questions?
Yeah, feel free to chime in. I have a question, Kristine. Now, you know, I see people on these electric scooters, and I'm thinking, well, that's a great way to get around, but that doesn't give you a whole lot of exercise.
Mm-mm.
Now, I know that, you know, my dad, when he went into assisted living, you know, before assisted living, he was walking and getting around, and, you know, he was much healthier than once he went inside. And once he did, all he did was sit around all day.
Mhm.
You know,
Yeah.
I mean, how do you balance between getting around and getting around easily?
Sure.
know?
So again, it's a lot of education and kind of finding out what drives the person. And a lot of people, it's okay to do the scooter. They don't necessarily want to walk. So, you know, you kind of have to figure out what they want to be able to do. But yes, so the more assistance you have, the less work you're going to do yourself. So that's always going to be a caveat when you're using an assistive device. But the big thing is to me is, what are you the safest using? So I always try to make sure, like, I have a lot of patients that have lots of different assistive devices. They have the electric scooter, they have, you know, a wheelchair and a walker. So I try to put up a plan of, okay, you know, use your scooter or your electric wheelchair when you're going grocery shopping, but use your walker when you're walking in the community, or walking in your apartment, those kinds of things. So trying to kind of set boundaries for them, I think, can be really helpful. Make sure that they're still moving. And again, educating that if you don't use it, you lose it. That's the standard thing. And it completely applies to walking. If you're not walking, you're not going to be able to walk eventually. So kind of, you know, reiterating that. And sometimes that just gives people enough of a bump to be like, yeah, I probably should, you know, walk a little bit more, those kinds of things. So kind of setting parameters on the assistive device, I think, can be kind of helpful.
Mhm. Yeah, Julie, chime in.
Hi. So I have a lot of thoughts going through my head. So my name's Julie Larson. I am the lead case manager at Verona Senior Center. And I'm sure you're familiar with this, but I'll just explain. We have, since I started here, we've had a loan closet. So we loan out equipment to people who call. And we have some occupational or physical therapists that call us and say, you know, I'm looking for this for somebody I'm working with. Great, we loan it out. But when an individual calls and says, you know, do you have a 4-wheel walker? We're giving them a 4-wheel walker, and we'll help them like set it up so it's like the right height for them. But none of us are occupational therapists.
Sure.
And so, I just realized my video is not on. I'm sorry. Hi. So none of us are occupational therapists. So like when I'm listening to your presentation, part of me is like, maybe we shouldn't be loaning this out, or maybe at minimum we should be, you know, saying, hey, we can loan this out, but you should really talk to your doctor about it. Do you have thoughts on that?
I would say you definitely need to talk to the doctor about it. Like I said, there's a lot of things that go into the having an assistive device than the assistive device. And a lot of times, you know, if we think that we need something because Jan down the street has it and it helps her, but Jan down the street is completely different than you are. So I definitely think, you know, it's to have the program to be able to lend it out, but I definitely think that having that conversation of talking to the doctor, making sure that this is the appropriate thing for you to use is the right way to go, as well as making sure that they're using it correctly. Like I said, a lot of people don't use the brakes like they should. The number of people I've treated that have fallen because they've missed the seat because they don't put the brakes on, because the walker gets away from them, those kinds of things. It happens a lot. Or using
Okay.
it on the wrong side is actually causing a lot more pain for them, those kinds of things. So, yeah.
Okay, and one follow-up question.
Sure.
If a doctor wants somebody to have something, does Medicare usually pay for it? Because then that's the other thing, I think, you know, if we didn't have the loan closet, like, would we want somebody to bring something from their doctor saying that it was ordered, or what if they can't pay for it, but it would be really useful?
So I do know Medicare does cover assistive devices. I don't know exactly all the caveats to it. There's a lot. It's always case by case, and how many or what they'll allow every year or 2 years or 3 years.
Right. Okay.
Kind of based off of that. Like I said, I do know a lot of insurances cover it. You have to get the script from the doctor first and then go through there. And a lot of times it does take a lot longer than just going to the pharmacy to buy it. So that can always be kind of frustrating too. But I would say if they did have Medicare, you know, and the doctor prescribed it, I would have them like loan it out from you. And then also then while they're waiting for their Medicare to approve theirs, then they can actually, you know, use the assistive device that they need at that.
Okay. Well, and I have had some people who, like, they'll come and they'll pick something up on the way to their OT appointment. So they have it for, so that would be great, but we should probably rethink that. Thank you very much.
Yeah, you're welcome.
Kristine, it's Bruce. I just wanted to say one of the scariest things that I see a lot of the times would be people who sit on their four-wheeled walker and propel themselves like it's a wheelchair or a chair, sometimes even backwards. I've seen people in the grocery stores even doing that. Do you want to just make a comment maybe on the safety aspects of those seated four-wheeled walkers?
Yes, the seated four-wheel walkers. They're not meant to be wheelchairs. The seat is meant for a rest break. It's meant to be pushed up against the wall, brakes are locked, and then you turn and sit, take a rest, and then you get back up and go about where you're going. And that's what the seat is for. It's not a wheelchair. So yes, that can be very dangerous. Slipping out of it, those kinds of things definitely happen. So
I wanted questions, anyone? Yeah.
I wanted to make a comment. I've been just looking at the chat since I think it's Ashley Hillman has made a comment about stepping on. And for the person who was talking about what to do for their parents, if they could look and see if there is such a program like that in Florida that they could attend, maybe by Zoom. I've done that program and I've looked around my house as to how to improve it. I even had someone from one of the agencies here in town evaluate my house. I don't have any throw eggs in my bathroom anymore. I got rid of a big runner in my hallway. And all of that was because of the class that really took time and energy, you know, and learning exercises to do. For balance, I think is really helpful. So that stepping on class for people who are in Wisconsin, I think, you know, people should definitely look into that. And then I think for someone who's in another state, maybe look and see if there's an agency that might be, you know, oh, hey, you know, there's this agency will come in and evaluate your house. And maybe someone else came in and said, oh, geez, you got, you know, all these magazines on the floor and you're going to fall. I'll just tell you, I've been incredibly unsuccessful with my sister and her husband who are older. You know, they like their rugs. They take their shoes off when they go into a carpeted room. And when they come back out, they don't put their slippers back on. They walk on the floors and they don't have any slip things on their stairs. And my sister, after she goes to the bathroom, unplugs the nightlight so it doesn't shine, even though it turns off very shortly after. So it is, I think it's very difficult unless people get the message somehow from a different way. I'm going to try to encourage, my sister and husband to take this course. They can do it by Zoom. I don't know how successful I'll be, but believe me, having done this class and trying to encourage them to be more safe has not been terribly successful. It is difficult. They leave magazines on the floor in their, just all the things that we know are so dangerous for people. It just drives me crazy. They have a 2-story house. They run up and down the stairs. My sister runs up and down in her stocking feet on a wooden stair. It's an accident waiting to happen. So I think it's a real problem for people to try to help others. And I think maybe, try to encourage them to take a class, or I love that My Mobility page. I think that's a fabulous page. The other suggestion I made in chat that people may not have read was, I'm a librarian. If you just type in My Mobility and CDC, you'll get it. You don't have to type that whole big complicated thing.
Okay.
Just type in those words in Google and it'll come up. And that's my comment.
Thank you, Jane. I appreciate it. I love all those comments. It's exactly
Yeah, I
what
wanted to get Ashley Hillman on just for a second. Can you jump in here, Ashley?
Sure. First of all, great presentation. I just was like nodding my head the whole time. Yes, this is so great. Yes. Oh my gosh. And a lot of the content that you covered is actually part of the curriculum of Stepping On that Jane was just talking about. And it's good to see you, Jane. I remember you the virtual workshop. But so if anyone's interested in Stepping On, I do coordinate Stepping On for Dane County. And we do have some virtual workshops that we're hoping to get scheduled for 2022. And we're in the process of scheduling in-person workshops now. So if you have any questions about that, feel free to contact me. I think someone also put in the chat who to contact if you're in Racine County. It is a national program. So I think the advice to check with your local aging office or ADRC is a really great idea. Thinking of you, Liz, with your parents in Florida. But I'm happy to provide any information about Stepping On specifically, or about here in Dane County, we have a Dane County Falls Prevention Task Force. And I'm happy to talk about that offline with anyone. Again, fabulous presentation. And I was actually going to send you a private message and see if you would be a PT guest expert for Stepping On sometime for our program here in Dane County.
That'd be great. Thanks.
Great. Okay.
One thing, Kristine, I was wondering, what type of assistive equipment is there for people exercising? Getting around on the sidewalk is one thing, but having some supportive equipment, I don't know. There's lots of gym equipment, but is there anything special for people exercising?
In terms of if you have balance issues,
Mm-hmm.
a lot of times I'll use like ankle weights, those kinds of things to really build some of that strength in the legs. So that's kind of a good way to do it. And so you don't have to be standing necessarily. A lot of other exercises is using, being at the countertop, or having the walker in front of you with brakes locked, obviously. Usually the counter is the big one if you're going to do it at home, or like a banister or some kind of support there. And then just making sure you have like a chair behind you in case you need to, sit down, or, that kind of thing. So I think that's kind of a big thing when I am teaching people to do exercises on their own at home, is making sure you have support in the front and a chair in the back, just in case need it. And again, that obviously all depends on the level where you're at, where your level is, honestly, for a lot of the exercise stuff. But I always say classes are really good to take. It's nice socially to get, out there and take exercise classes with other people, as well as those people teaching it should hopefully have modifications and things. And if they don't have modifications, find a different class, because that's not good. They should have modifications for you to make things easier and safer, and they should be trained and know how to do that. So that's something that I would recommend to most people too. I see.
Thank you. Yeah,
Tai
great
Chi is a
idea.
good one, yoga. They have chair yoga, different chair exercises, things like that. A lot of those silver sneaker programs through the YMCA, those things, those are really good ones. So.
Yeah, we have a rich set of resources in the county, and really it's just trying to help people know about them. That's really important. Anyway,
Yeah.
who else? Anyone else? Okay, well, we're at 11 o'clock here. We could go over if there's anything else, but I know Kristine's really busy, and Bruce has probably got a bunch of things for her to do yet, you know, before she heads out to have that baby. So let me call it quits right here. Remember, I'll have this video again on our YouTube channel, Triads of Dane County YouTube, and it'll be in a few days here. Thank you, everyone, for attending. I really appreciate it.
Thank you.
Thank you.
Thank you, Mike.
Thanks a lot.
Thank you.